Hello everyone, my name is Killeen White and I am the Chief Officer here in South East Community Healthcare. Together with my colleagues, Mr. Declan Lyons, CEO of Ireland East Hospital Group, and Mr. Jerry O'Dwyer, CEO of South Southwest Hospital Group, we are delighted to be here to present to you all the rollout and implementation of enhanced community care here in the South East. Some of our colleagues here in the South East will be presenting to you in greater detail as we move throughout this presentation. In the first instance, however, I wanted to talk to you a little bit about the general principles guiding us here in the South East, including general principles surrounding the rollout of enhanced community care. We were really delighted here in the South East to receive the investment to roll out enhanced community care, because enhanced community care will enable us to give effect to the true principles of Sláintecare. Sláintecare is centred on the delivery of services in the right place, at the right time, and by the right team and with the right people. This is so important for our patients and service users here in the South East. And a fundamental aspect of Sláintecare is the delivery of services as close to home as is possible and in our community settings. Equally, it is really important that we align our services to general practice across the region, because by doing this, we will truly give effect to the Sláintecare principles and to the principles of the delivery of right care at the right time, in the right place, and by the right people. A fundamental aspect of enhanced community care is the community healthcare network. The community healthcare network will be the foundation and organisational structure through which we will deliver services at a local level. Here in the South East, we will be rolling out 11 community healthcare networks. The community healthcare networks will also be supported by the development and enhancement of integrated care programmes for older people and the integrated care programme for the management and prevention of chronic disease. The integrated care programme for the older person will centre on the development of integrated pathways of care to ensure that our older people in the region can have a seamless journey through our health services. Meanwhile, the chronic disease programme will centre again on the development of integrated and seamless pathways of care. So our service users with conditions such as diabetes, or respiratory conditions such as asthma and COPD, or cardiac conditions can access seamless services in our community settings. This is all so important for our service users in the South East, and a key enabler is that of integration. Integration is sometimes easy to talk about, but it can be hard at times to deliver on true integration. It is important, however, to state that we are not starting from the beginning here in the South East. We already have really good and strong leadership and really good and strong, dedicated, integrated teams in operation right across the South East. Through these teams, we will continue to grow our enhanced and integrated relationships in order to give effect to enhanced community care. Enhanced community care will also be delivered through our integrated governance structures that are already operating here in the South East. The integrated steering group, which is made up of myself as Chief Officer, along with my colleagues in the South Southwest Hospital Group and the Ireland East Hospital Group. And as a group, we will really drive and lead out on the delivery of enhanced community care in the South East. In addition, the Integrated Action Group, which is also made up of colleagues from community and acute hospital settings, will lead out on the development and rollout of enhanced community care at a local level across all of the counties in the South East, to include Waterford, Wexford, Carlow, Kilkenny and South Tipperary. My colleagues in South West Hospital Group and Ireland East Hospital Group are very aware that there is going to be challenges ahead. But we are very proud of and have great faith in our staff teams here in the South East. And we know that these challenges will be overcome. Together, we will work in partnership and in collaboration with each other to really roll out enhanced community care in order to best serve the population here in the South East. My colleagues and I are very aware that it is really important to continue to update you all as we move throughout the implementation of enhanced community care. Through further integrated webinars and ongoing staffing briefings and updates, we will ensure that you are kept informed at all stages in relation to the rollout of enhanced community care and the implementation of enhanced community care in the South East. I will now hand over to some of my other colleagues here in the South East.
Hi, my name is Jerry O'Dwyer. I'm the Chief Executive of the South West Hospital Group, and I'm delighted to be part of the webinar on the Enhanced Community Care Programme in the South East. First of all, I would like to sincerely thank all our staff across the South East in our hospitals and community for their extraordinary efforts over the past 18 months. As we now rise from the challenge of responding to current and future waves of the virus, delivering the largest national vaccination programme in our history, restoring health services, meeting the new care demands and reducing the care backlogs that are a direct consequence of the pandemic. We know that it has taken its toll on our people, both nationally, internationally and indeed worldwide. I believe that supporting staff recovery, their health and well-being, and improving workforce supply, we can restore services in a sustainable way over the next period of time. In addition, changes to the care pathway were rapidly implemented during this period, ensuring patients were only in hospital if they needed to be. The same approach will now help us to transform the delivery and design of health services across both hospital and community, with the aim to reduce unwarranted variation in access and outcomes, help us redesign clinical pathways to increase integration and accelerate progress on digitally enabled care. We now need to take further steps to develop population health management approaches that address inequalities in access, patient experience and outcomes, working with local partners across health, social care and indeed beyond. The Enhanced Community Care Programme involves a major shift in the provision of care from hospital settings to our community, with greater emphasis on prevention, supporting people in the community with lifelong conditions, and working to improve access across the system and expanding services that support people to remain at home or as close to home as is possible. The South West Hospital Group, incorporating Tipperary University Hospital and our Level 4 hospital in the South East, University Hospital Waterford, are very proud to support the delivery of the Enhanced Community Care Programme and the wider health service reform, including and importantly hospital bed capacity, to focus on isolation facilities in our hospitals and also our critical care capacity. To progress the implementation of health service capacity review and indeed assist in the rollout of Sláintecare. Our shared local governance structure across the integrated steering group involving the South-South-West and the South-East community healthcare will encourage innovations in development of an integrated services end-to-end care pathways for our patients and their families. These are both challenges and opportunities ahead. The health service and our staff have shown the ability to embrace change, to adapt and develop new services and innovations at scale and pace. We now need to build on these improvements alongside the development of system working and collaboration for the benefit of our community into the future. Thank you.
Hello everyone. In 2021, we've commenced the implementation of a major service reform in line with the general principles of the Sláintecare programme. In particular, this involves a shift in the provision of care from hospital to community settings where appropriate. There's also greater emphasis on the prevention strategies, supporting people with lifelong conditions in the community services rather than in our acute settings, while also working to improve access across the system and expanding services that support people to remain at home. This whole system reform is critical to addressing the long-standing challenges of our health service. Delivering an integrated service between our hospitals and our community services will contribute significantly to addressing such pressures as our growing scheduled care waiting lists and pressure on our EDs, which can result in long waiting times for some people. In particular, the ECC programme will deliver a much better service for our most vulnerable older people and also for those who have more complex needs. The focus is an end-to-end pathway that will prevent admissions to acute hospitals where it is appropriate and safe to do so. For patients who require admission, the emphasis is on minimising hospital stays and improving their outcomes, with post-discharge support for people in the community and in their own homes. The presentation you're about to see describes how community services are being significantly strengthened, thereby moving away from the existing hospital-centric model of healthcare delivery. This should, over time, reduce emergency presentations and admissions to hospitals. It will also and should also eliminate or at least significantly reduce the delays in the transfer of care for those population cohorts. It should also lower ED waiting times and the number of people that we currently experience on trolleys. Ireland's hospital group, which includes St Luke's Hospital in Kilkenny and Wexford General Hospital, are very supportive of the delivery of the Enhanced Community Care programme. Furthermore, we are also very supportive of the wider health system and service reform programme under the guiding principles of Sláintecare. Delivery of those principles is outlined in the Sláintecare programme will see the right service delivered in the right place and in a more timely manner. As appropriate, it will see a shift from care currently being provided in our acute settings to a community setting. This is not just good from a service delivery point of view, but also better for our patients. Working alongside with our colleagues in the South-East Community Healthcare, we will continue to collaborate jointly towards delivering an integrated end-to-end care, keeping people out of hospital, enabling a home-first approach, and ensuring people are discharged from hospital without delay. Our shared local governance structure through the integrated steering group across Ireland East and South-East Community Healthcare will support the development of an integrated service and an end-to-end pathway. We are proud of our successful integration, and we know by working together we can deliver better outcomes and better experiences for our patients. For example, the new Sláintecare funded project whereby Wexford General Hospital and South-East Community Healthcare are integrating their acute and community services for older people, which provides geriatric assessments for older people in the community setting and has reduced waiting times from 6 months to 6 weeks. Patients' feedback in respect to this particular service and pilot has been extremely positive. Here in Ireland East, we are fully supportive of the ECC programme and working with our community colleagues in the delivery of enhanced services and improved appropriate pathways for our patients. I'd like to thank you all for taking time from your busy schedule to view this presentation. And thank you.
We will now begin our Enhanced Community Care presentation, and I will share the presentation with you all now. So as I said, We are delighted here in the South East to be receiving significant investment into the development of our community services. Whilst we will work in collaboration with our colleagues in the acute hospital settings, the CHO management team will be front and foremost in the rollout of enhanced community care. This diagram shows what that structure looks like, with our head of primary care, our head of disability and our head of older persons, which make up social care, our head of health and well-being, and our head of mental health. And together with the head of service for quality and service improvement, we will work with our acute hospital colleagues to really deliver on enhanced community care in the region. Fundamental to that is integration across our care groups and aligning our services with general practice right across the South East. So not only is integration focused on integration with our acute hospital colleagues, it is also focused, as I said, on integration across our community care groups and integration with our general practice colleagues right across the South East. And it is important that that collaboration and integration is developed as we move forward, because it is only through integration will we really deliver on enhanced community care. The importance of integration really cannot be overstated. And I'm delighted to be working with all of my colleagues here in the South East to drive that integration and to drive community service developments. One fundamental area of importance is that of population health planning. Each community healthcare network will focus on a population of 50,000. And within that 50,000, we will be trying to strive to deliver the best services possible for that 50,000, but also looking to the future and what services we need to develop in terms of strategic development and delivery of enhanced community care. So I suppose one fundamental question to ask is why we are doing this. And the reality is that we are doing this for our service users and our population here in the South East. We want it to be easier for people to navigate through the health services. We want it to be easier for people to access those services and move throughout those services in an easy and seamless way. And we want to do this so that people can access the right care at the right time, in the right place, and by the right team. In addition to wanting to do this for the population here in the South East, we're doing this in order to make it easier for our staff teams to deliver integrated care. We have a fantastic workforce here in the South East, and it is our job to make it easier for that workforce to deliver integrated care. And I have no doubt that we will do that here in the South East. I am now going to hand over to primary care to talk to you a little bit about enhanced community care within our primary care settings. Thank you.
Hi, my name is Susan Murphy. I'm primary care lead in Waterford, and I'm here today to talk to you about the primary care developments in South East community healthcare. Enhanced community care for overview of primary care developments. So in order to develop primary care services, there's a number of things that need to take place within the South East community healthcare. One of those is an integrated care approach where all of the services will be working together, and it's going to be centered where the service user will be the center. New leadership roles are coming into place, and this is going to involve the GPs, the management team, and all of the primary care staff working together as a team. Different structures are coming into place, and in the older section we would have had general managers, but now under the general managers and the structure we will have community network managers coming in, and these will work with GP leads. So in order for this to happen, the 9 community healthcare organisations are in place within the country, and we are one of those 9 community healthcare organisations within the South East. So within the South East community healthcare, we will have 11 networks, and within the 11 networks within South East community healthcare, we will have a number of primary care teams. And within the primary care teams, there will be an average of 4 to 9 primary care teams per network. And it is hoped that all of these networks that are illustrated within the slide that I'm sharing with you at the moment will have their own structure of network manager, GP lead, and primary care teams all working together to improve services for patients going forward. GP access to diagnostics has been developed over the past year in the South East. GPs traditionally would refer to the acute hospitals, and now going forward, as a result of the South East Community Healthcare Future Diagnostics Group that has been established in primary care, GPs have now direct access to all diagnostics, and this will be very beneficial in avoiding patients going to emergency department and unnecessary outpatient appointments. A structured pathway has been developed, and the group will continue to offer those services to GPs. The community intervention team is another enhanced service that has been established in the South East. Traditionally, community intervention teams developed a number of years ago, but in relation to enhancing community care service, the provision of these services has been rolled out to all 5 counties, with Wexford being the final one in February of this year. The integrated model of care for prevention and management of chronic disease is another enhanced service that is developing in South East Community Healthcare and also across the country. The chronic disease management framework supports the 4 major diseases, which is cardiovascular, the COPD, the asthma, and the diabetes across South East Community Healthcare. Traditionally, patients with these diseases would be treated in the acute setting. But as a result of Sláintecare here in the South East, we had 4 very successful projects in asthma, diabetes, and COPD, and we rolled them out over a year period, and now we were in a position to establish our own chronic disease management hubs. In the initial phase, there will be 2 hubs in Kilkenny and Waterford, and then these will develop into Wexford and South Tipperary. Currently, terms of reference have been produced, and the acute sector is meeting with primary care bodies, and these pathways of care are developed both nationally but also locally, and relevant stakeholders have been involved between the acute sector and primary care. Recruitment is ongoing in the process for the chronic disease management teams, and primary care colleagues are in consultation with our estate partners in relation to deciding on the location of the hubs, and work is progressing at a very rapid rate. Just to give you an example of what exists in the chronic disease management hub, it will consist of a respiratory team, a GP lead, and admin and management to support the team. The respiratory team will contain clinical nurse specialists in respiratory, physiotherapy, coordinators, rehab programs, and a number of, there will be a GP lead with specialist interest that will sit on the governance group for this, and it will be driven by a project officer and a service improvement lead. Similar to this, with diabetes, we have clinical nurse specialists in diabetes, we'll have podiatry specialists, we'll have dietitian and weight management dietitians. And the aim of this is to keep as many patients as possible out of the acute sector and to have a direct resource for GPs to refer into the hubs, thus having A&E free for people who need to go there. And under the cardiology team, we have clinical nurse specialists for in cardiology, physiotherapists, rehabilitation programs, and a clinical physiologist also. I'm now going to hand you over to my colleague Derval Howley, and thank you for your time.
Hi, I'm Derval Howley. I'm the Head of Health and Wellbeing here in the South East. I'm delighted to be here talking to you about the implementation of enhanced community care within health and wellbeing. I'm just going to share my slides with you now. Many of you will be familiar with Healthy Ireland, and within the health service, our focus on Healthy Ireland is on 3 main areas. The first is in relation to healthcare reform, and we see this as our greatest opportunity. The second is in relation to chronic disease management which is our greatest challenge. And the third, and importantly, is on staff health and well-being, and our staff we see as our greatest asset. From an enhanced community care perspective, we have a significant amount of new resources coming into health and well-being by way of health promotion officers. Susan will have spoken earlier in relation to the community health networks, and in phase 1, 6 of the 11 community health networks will have a new health promotion officer working as part of that multidisciplinary team. This will be expanded to all of the community health networks in phase 2. The focus of their work will be around prevention, early intervention, supporting self-management, particularly for those with long-term chronic conditions. And looking at this, we'll be looking specifically around tobacco, around making everything contact count, which is a brief intervention training for all healthcare workers. The focus for making every contact count is making sure that every contact that we have with an individual that we serve, that's accessing our services, counts and looks at those behavioural changes that can support a healthier lifestyle. The staff will also support staff health and well-being and will be involved in stakeholder engagement. And what we mean by this is, under Healthy Ireland, we know that health is everybody's business. We can't address health just within the health service itself. We need to work with all our partners, the local authorities, with TUSLA, with the community and voluntary sector, and most importantly, with the individuals themselves that we support and serve. Susan would have spoken earlier in terms of in phase 1, our first 2 chronic condition specialist hubs, and we will have an additional 2 smoking cessation officers, 1 working from each of these hubs. In relation to the smoking cessation service, it's really important, and one of our learnings from our Sláintecare Quit and Stay Quit programme is a non-judgmental service, that we look at smoking as a care issue and that we treat those that smoke with care, with respect and in a non-judgmental manner. The smoking cessation officers will prioritise those with long-term care conditions, but will also serve the wider community. So that population that Susan was talking about previously, around 150,000 per hub. I'm delighted to say that recruitment is well underway, interviews have taken place, and the initial 8 posts that I've just spoken about have gone out for offer, which is great. So we should see staff on site shortly. In addition to the enhanced community care, we also have our Healthy Communities initiatives. This is funded centrally by government and focused in phase 1 on 19 key areas across the country. In the southeast, we're very fortunate to have had 3 areas selected. The aim in terms of healthy communities is one of the key goals of Healthy Ireland, which is around reducing health inequalities. So it specifically focuses on areas of high risk factors to health and well-being of the population. We work with the Pobble maps in terms of looking at those areas of high disadvantage, but also looked at areas where we have a high proportion of the population in terms of young people. This is targeted initiatives, but also working with a range of key stakeholders. So we'll be working with the local authorities, with TUSLA, with the community and voluntary sector, and with the community as a whole. The services that will be provided within these 3 targeted locations will be the Making Every Contact Count, so that brief intervention training that I spoke about earlier. The social prescribing, and social prescribing is having a link worker within the community that will meet with individuals to link them into the services, to the supports, but also to their areas of interest and hobbies that they can engage with within the local community. We'll be working with TUSLA in terms of the provision of parenting programs, and they'll be provided through the community and voluntary sector. We also have smoking advisors, and again, they'll work in a similar manner, non-judgmental, with respect, with smoking being seen as a care issue, and the delivery of the We Can Quit programs. Healthy Food Made Easy is one of our healthy eating initiatives, and it's a healthy nutritional program targeted within the community, but really easy to achieve healthy foods training. So we're looking forward to that as well. The key areas in terms of the 3 locations for phase 1 under the Healthy Communities are South Tipperary, with a key focus in the early stages around Clonmel, and you'll see the area highlighted in the map there. The second area is Waterford City, but it also stretches out into Ferrybank, so an element of County Kilkenny there included as well. You see it on the map. And lastly, in terms of for phase 1 will be Wexford. Predominantly around Enniscorthy, Wexford and Caman area in County Wexford. So just looking in terms of resources and what that means. Within Healthy Communities, 2 areas have been selected for childhood obesity teams, and we were delighted for the South East to have been chosen. So Dr. Kathleen O'Sullivan, our Principal Medical Officer, led out on this, and a full multidisciplinary childhood obesity team will be funded within the South East as part of phase 1. In relation to the Healthy Communities regional supports, the Health Promotion team will have a new Senior Health Promotion Officer to coordinate Healthy Communities. They'll have a Grade 5 support administration and a MEC, and that MEC is that Making Every Contact Count mobiliser to support staff, to train them in making every contact count, and ensuring that that's the approach that we're taking. Every contact that we have with somebody counts in terms of supporting them around behavioural changes for a healthier lifestyle. And similarly, each of those areas will have one smoking cessation officer. Working with our partners in the community then, community and voluntary agencies will be providing a social prescribing link workers. With TUSLA, we've gone out for expressions of interest for the delivery of the parenting programs. And similarly, in terms of the Healthy Food Made Easy, We Can Quit programs. And alongside that, we'll be funding to support medication in terms of stop smoking medication, like the nicotine replacement therapies. And then supporting us all in terms of the health promotion and awareness will be a communication support within the health promotion team. So a really exciting time for us. We're looking forward to working across with each of our acute colleagues and community colleagues on this exciting new phase for the health service. I'm going to hand you on now to Barbara Murphy, who's our Head of Service for Older People. Thank you very much for your time.
Good morning, I'm Barbara Murphy, Head of Older People Services in the South East Community Healthcare. And I'm going to speak to you this morning on the integrated care of the older persons programme. I just want to share my presentation. Nationally, the integrated care for older people is known as the ICOP, and the aim of the integrated care for older persons is to develop and implement integrated services and pathways for older people with complex health and social care needs. And really, this is about shifting the delivery of care away from acute hospitals towards community-based, and we plan and coordinate those services, and we're trying to keep them out of people going into acute hospitals and also into nursing homes. The objective, I suppose, of the programme is to improve the life of older people by providing access to integrated and to support them and plan around their needs and supporting them to live well in their own homes and communities. The Older Person Service model is an establishment of community-based multidisciplinary teams, and what we call the MDTs, they operate on an interdisciplinary basis, and this obviously inevitably will raise issues associated with authority, accountability, and to a need to avoid professional silos, where the person may come into a clinic and they may never see the consultant they actually might only need to see a physiotherapist or an occupational therapist. So these integrated care, we're hoping to hold these in the ambulatory hubs. And the ambulatory care hubs actually can be held in a variety of physical locations. And it really will depend on the local infrastructure. So they could be in a primary care centre, they could be in a day hospital, or they could be in any other community location. The fundamental functions of these ambulatory cares is to provide an MDT-based equal access to service users or carers, facilitate operational services and strategic development, and to act as a focal point for service coordinated integrated care pathways. The purpose of the hub is to act as the single point of access to specialist secondary care to older adults with complex cases and chronic disease, but for a defined period of time. The multidisciplinary team based in the hub will receive referrals from primary care or acute hospital teams based on the specific referrals. So the 10-step of integrated care framework for older persons. Nearly everybody nationally now have heard of this framework. It's like the Bible in older people's services. Now, I'm not going to go through the 10 steps today, but I just want to pick out 2 or 3 of them that are really well worth it. I suppose number 1 is integrated care will not happen unless you have a good governance structure. And where there is good governance structures, you'll get the gold star framework in place. The second one would be that I would always recommend to services is that you map your local care resources. And I will, in my next slide, I will explain to you how you do that. The fourth is to develop and plan the care programs that you want to do, and then develop multidisciplinary ways of going and new ways of working, and then to develop your teamwork into clinical ways of working. And I suppose the biggest factor here is that you have person-centric care and the planning of the service delivery, so that we have the client in the middle of everything, and that we work around the client, not the client work around us. And I suppose that is one of the biggest issues to take away for the 10-step integrated care framework for older persons. So this is what we call a heat map. And these are recommended for any integrated care program to start. And that is about looking at what you have, looking at the specialist ambulatory care hubs. In this diagram, you will see green, amber, and red. The green is what we have at the moment. The amber is what we need to develop. And the red would be a required component to get to the green and to have the whole service in place. Now, when you're doing one of these heat maps, everybody needs to come together. It has to be integrated, both community and acute hospitals. And often people think when they're doing these that it's a way of solving their local issues. And what I always say when I'm doing one of these heat maps, people, is the local issue goes into the car park, and you put another piece as the car park, and the local person takes the car park away and sorts it out. And then if they can't solve it, we bring it back into the implementation group and see if that's a blockage for developing integrated care. Most heat maps work very well, but you have to have an integrated approach for the heat map to work, so that we know what we're doing, and it's meant to be providing specialist ambulatory care hubs, and that we're providing the care for older people services in our South East community healthcare. So I just want to thank you for listening to me today, and I want to refer to the briefing document that accompanies this presentation, and any further information, please contact Anne-Marie Lanigan, Head of Primary Care, Susan Murphy, Primary Care Lead, Waterford, or Dervla Howley, Head of Health and Wellbeing, and Barbara Murphy, Head of Older People Services.